In this video, we're going to look at 6 plant foods that scientific research has shown can greatly help to reduce osteoarthritis pain. And some of the foods are quite surprising. Pause the video and put your 6 guesses in the comments. Number 1. Ginger. Ginger has been shown to give significantly better results than placebo when it comes to osteoarthritis. Many trials have shown such impressive results that ginger is considered to be able to reduce pain and disability in osteoarthritis. The doses used were around 1/4 to 1/2 teaspoon a day. Interestingly, this dose can also improve stomach lining protection, which may counter some of the damage done by pain medications such as ibuprofen. Number 2. Sesame seeds. This study found a significant drop in inflammatory markers. 50 patients with osteoarthritis of the knee were split into 2 groups. The first group received standard treatment, and the second, standard treatment plus roughly 1/4 cup of sesame seeds a day for 2 months. Before the trial, participants had described their pain as around 9 out of 10, where 0 is no pain and 10 is the maximum pain tolerable. After 2 months, the control group felt a little better, with their pain down to 7, but the sesame group dropped down to 3.5, which is significantly lower than the control group. The researchers concluded that sesame appeared to have a positive effect, improving clinical signs and symptoms in patients with knee osteoarthritis. Number 3. Strawberries. Strawberries can improve pain and inflammation in knee osteoarthritis patients. Patients were randomized to get around 1.5 pints of strawberries a day for 12 weeks, and researchers found that certain inflammatory markers were significantly reduced on the strawberries. The patients also experienced significant reductions in constant pain, intermittent pain, and total pain. So they concluded that simple dietary intervention, the addition of berries to one's diet, may have a significant impact on pain, inflammation, and overall quality of life in obese adults with osteoarthritis. Number 4. No surprises here. Turmeric. Curcumin, the orange pigment in turmeric, has been found to prevent the release of inflammatory chemicals. 50 patients suffering from mild to moderate knee osteoarthritis were either given the best available medical treatment, which included control with anti-inflammatory drugs and painkillers, or the best available treatment along with this proprietary curcumin supplement. And the group with the added curcumin did significantly better and were able to double their walking distance. They were also able to significantly decrease their drug use, experience significantly fewer side effects, less swelling, hospitalizations, and other treatments. In this study, around 100 sufferers were randomized to ibuprofen or concentrated turmeric extracts for 6 weeks. 2 grams of Curcuma domestica extracts were given per day, and the curcumin group did as good or better than the ibuprofen group. Number 5. Broccoli. In vitro, sulforaphane found in cruciferous vegetables protects cartilage from destruction, which suggests that a high broccoli family vegetable diet may be a useful measure either to prevent or to slow the progression of osteoarthritis. So we knew sulforaphane can protect cartilage cells in a petri dish, but what we didn't know was if the compound could make it into the joint when we eat it. But then this study was conducted, and sulforaphane was detected in the synovial fluid of 40 patients with osteoarthritis following broccoli consumption. And quite remarkably, there were significant epigenetic changes of gene expression within the joint. As a bonus, another member of the cruciferous family that also contains sulforaphane is cabbage. And amazingly, in this study, patients with confirmed osteoarthritis of the knees were randomly assigned to 4 weeks of treatment with a cabbage leaf on their knees every day, or a topical pain gel containing an anti-inflammatory drug, or neither. And researchers found that cabbage worked. Overall, the study found that a 4-week application of cabbage leaves was more effective than usual care with respect to pain, functional disability, and quality of life. But it was found not to be quite as good as a 4-week application of topical medication. But the upside is cabbage leaves are safe and can be used long term. And finally, number 6, rose hips. Rose hips are the fruits of the rose bush, and this study found that they caused a significant reduction in pain in osteoarthritis patients. Dr. Greger recommends buying them dried in bulk at a local natural food store and eating them straight. He says for arthritis sufferers to check with their doctor before starting on a dose of 10 rosehip berries a day.
Thank you so much for watching. If you liked the video, please give it a thumbs up, leave a comment below and subscribe for more upcoming videos.